tech neck. And joining me now is Dr. Brian Sue, a spine surgeon at Marin General Hospital, with how to protect yourself. What's going on here? I would have thought it's, I looked in our newsroom today because I knew you were coming in, and I saw a bunch of people on their computers like this, but is this more of a phone thing or a computer thing?
So it's a little bit of both. Tech neck is essentially neck pain that develops in people that are overusing their devices with a head flexed down position. So the head is essentially a 10-pound bowling ball. It's sitting on a stick. So if you flex your head forward, looking at your cell phone, or if you're typing even 45 degrees, the net increase in force on your cervical spine or neck is about 50 pounds. So then your entire muscles, ligaments, discs, things like that are holding up your neck. That predisposes to degeneration in your cervical spine.
We see everybody. They're walking around wherever. Everybody's like this.
That's right.
So what do you tell parents? What should they, it's really hard to limit screen time on a computer or an iPad. Never mind everybody's addicted to their phones. What do you do?
So it's all about posture and position. So if you have a desk job and you're sitting at the desk, or you're playing a video game, or you're programming, set a timer every 30 minutes. Get up, walk around, do 2 stretches in the doorway. They're called doorway stretches. Open up your spine, 30 seconds, sit back down. A sit-stand desk is one of the best things you can do. And keeping your eyes at screen level, and even elevating the cell phone by 10, 20 degrees will take 20 pounds off of your neck.
Yeah, we actually just upstairs are getting a bunch of standing desks installed. So does that help?
It's perfect.
Okay.
You have to change positions often, though. You don't want to stand the whole day. You also don't want to sit the whole day.
Okay.
So just frequency in changing of positions helpful. And there's certain exercises you can do for your neck as well.
Like what?
Periodically during the day. So the 2 best ones are, like I said, the doorway stretch. And the other one's a chin tuck. No one likes to do it. It's the double chin move, where you essentially move your neck back for 5 seconds, shifting it back, and then relaxing. Okay. So that promotes what's called cervical lordosis. You'd said about x-rays of younger patients that have x-rays of 60-year-olds. Sometimes I'll look at an x-ray, go into the room, think I'm seeing a 67-year-old, and there's a 20-year-old kid there because their spine is totally flexed forward and degenerated. So doing that
already as a teenager, that's shocking.
So doing a chin tuck will prevent that.
Okay.
A couple of seconds, then relax. That promotes what we call cervical lordosis, which is a curvature in the neck.
So it's not real attractive, but okay, if it works. I've seen some devices that have been advertised, you see them all over the place, where they're braces essentially for your posture, straps. Do you recommend those sorts of things? Does that help at all?
I think bracing can be dangerous because bracing eliminates the need for your core muscles to actually hold your body up.
Okay.
So wearing a brace for an extended period of time, it's fine, it'll sit you upright, but you're basically weakening the muscles and your core muscles on the inside. So for a short period of time, bracing is great, but I would not recommend extended bracing. I think it'll weaken your muscles overall.
Given the trend that you're seeing, will our ancestors look back at us and see our skeletons go, what was happening in the 21st century? Everybody was left like
cavemen.
Yeah, exactly.
We'll all look like this. It's that progression, right?
We can joke about it, but this is kind of a serious problem.
It's a real thing, and particularly in the last decade, we've seen 20, 30, 40-year-olds in my office that, they come in, their heads are pitched forward. There's actually a phenomenon called drop head phenomenon in older patients. And it's almost analogous to that. When I'm in a subway or just at the airport, everyone's like this.
Yeah. You see it all the time.
Everyone's like that. So just elevate it a couple of degrees, not so high so it's hurting your shoulders, but just doing that's going to help you avoid neck strain and neck pain.
Doc, great advice. Thanks for coming in. By the way, last living man with a BlackBerry right there.
Whoa!
I was saying, you can't take selfies. You can't get selfie wrists from it because BlackBerries can't take selfies.
That's perfect. It's great meeting you. Thanks for coming in.
Thank you.